Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Have you ever suffered from pain in your shoulder, right one or left one, or even both at the same time? When the pain was gradual and it was associated with stiffness, and time came when it was so painful that you couldn't move even an inch, and you were using the painkillers for it. And you may have consulted your doctor who may have diagnosed a frozen shoulder for you. So today we are going to discuss what does frozen shoulder mean, what are the causes of frozen shoulder, what are its symptoms, how we diagnose and how we treat a frozen shoulder. So what the common things or what the overview should be known to the public, we shall discuss all these in today's vlog. So be with me to get answers of all these questions. As I mentioned in the intro, we shall discuss the frozen shoulder today. So what the frozen shoulder means? Frozen shoulder is a condition characterized by stiffness, limited mobility, and pain in the shoulder joint. It may be one shoulder or another or both shoulders at a time. So it's a condition characterized by stiffness, limited mobility, and pain. What are the causes of frozen shoulder? What conditions are associated with frozen shoulder? There are different causes, but the main causes include injury or trauma to any shoulder. If the shoulder had sustained injury or trauma, unexpected, or even in some fall or fight, it can lead to frozen shoulder. Another cause is autoimmune disorders like diabetes, thyroiditis. The third common group of causes are inflammatory conditions like arthritis. So, injury or trauma, autoimmune disorders like diabetes and thyroiditis, inflammatory conditions like arthritis. Or if some surgery was done on the shoulder or it was immobilized because of some condition, then it can also lead to frozen shoulder. At times, hormonal changes, for example, menopause in women, it can lead to frozen shoulder. And the age 40 to 60 years, this is the age at the peak incidence of frozen shoulder is seen. So age by itself can lead to frozen shoulder. So the common causes, I repeat, injury or trauma, autoimmune disorders like diabetes, thyroiditis, inflammatory conditions like arthritis, surgery or immobilization, hormonal changes like menopause in 45 or 40 plus women, and age at the peak incidence is 40 to 60 years, both in male and female. How the people who develop the frozen shoulder, they present. There's gradual onset of pain and stiffness. This is the most common presentation. That the disease to start with, there is gradual onset of pain and stiffness, and then it's accompanied by limited active and passive shoulder mobility. You cannot move that shoulder. There's painful and restricted movements like lifting, rotating. You can't do that. And it leads to difficulty with daily activities like dressing, grooming, and there's a pain at night and it disturbs the sleep. So it starts with the mild pain and limited stiffness, and then it leads to the advanced stages. Medically, we divide this into three stages. The frozen shoulder is divided into three stages, and if untreated, it may last for 2 years. The first stage is called freezing, and it can be from 2 to 9 months. Freezing is the first stage. Second is the frozen stage, when it becomes frozen, and this may be from 4 to 12 months. And then it's a thawing stage, which can last for 5 to 24 months. In the freezing stage, the first stage of frozen shoulder, which may last from 2 to 9 months, there's pain and stiffness gradually increases. Then in the frozen stage, which can last for 4 to 12 months, the shoulder becomes increasingly stiff. There may not be pain, but it becomes stiff. And then the thawing stage, the third stage, which may last from 5 to 24 months. We know thawing means melting of the snow. So the mobility improves and the pain decreases. So if untreated, it can go through these three stages: freezing, frozen, and then thawing. What's the treatment for frozen shoulder? There's a conservative treatment, there's a surgical treatment, and some alternative therapies are available. In the conservative treatment, physical therapy has the most important role. Proper physical therapy, exercises, mobility exercises, pain relieving maneuvers, and the physiotherapy, your physiotherapist will advise you on that. Then the pain management. And in this, we give analgesics, painkillers, even steroids. Anti-inflammatory medications, this is important. And of course, home exercising, stretching, heat or cold therapy. All these are the conservative ways to treat frozen shoulder. But remember, treating the underlying cause is the main key of success. Then at times the conservative therapy fails, the medical therapy fails, it may be required the surgery is done. What is that surgery? One is arthroscopic release of the joint, manipulation under anesthesia, and of course shoulder arthroplasty in severe cases. So these three types of surgical options are there, but these are not required in each and every patient. It's required only in few selected and resistant patients. What are the alternative therapies? What people have used? People have used acupuncture, people have used massage therapy, chiropractic care, yoga, and Pilates. The home remedies for a frozen shoulder has been the pendulum exercises, the wall slides, arm circles, heat or cold packs, and over-the-counter pain relievers. People are using this without consulting their doctors. How we can prevent? Yes, we can prevent by maintaining a shoulder mobility, regular stretch exercises, stretching regularly, strengthen surrounding muscles, and avoid prolonged immobilization. These are the at least 4 ways that we can prevent frozen shoulder. When to ask medical attention, when you should go to a doctor and get the medical advice, when there's a sudden severe pain in your shoulder joint, Or your shoulder has become limited mobility, or you cannot move, it's difficult, you are feeling difficulty in moving the arm, there is numbness or tingling, or there is no improvement with your treatment, whether this was a conservative treatment, this was a massage therapy, and you are not improving, then of course you go to your doctor to get if some other treatment can be offered, if the other cause is there for the frozen shoulder. So dear colleagues, today we discuss the frozen shoulder. What does it mean? What are the causes? How this process starts? What are the stages? What are the treatment options available? Medical, surgical, alternative, how we can avoid frozen shoulder, and when a person with frozen shoulder should go and seek the medical advice. So take care of yourself, spend a healthy life, movable life, maintain your mobility, and all the problems, the joint pains, the neck pains, the backache, all these will fade away, will not come if you spend a healthy and active life. Take care. Goodbye. Khuda Hafiz.